Welcome to part two. So, in a part two, I'm going to be talking about what the procedure looks like. So, you arrive the day before, you wait 24 hours, and you have your day one of eye check. So, they basically take you to the room and they check all the I don't know exactly what they did, but they check the pressure in your eye. I think they check the shape of your pupil and stuff like that. They check how your eye look inside and crazy stuff, but they really do very detailed check just to make sure everything's fine. Then they obviously check the short-sightedness and astigmatism if you have one, or if you don't know if you have it, they will check if you do have it. And based on that, they're going to tell you what is the best procedure for your eyes, because they have a few types of lasers, depending on what you need. So I had to unfortunately take the most expensive one, which is femtolensic, and I think it was around £1,800, but it's obviously gonna differ because a procedure might get more expensive or less expensive. I also had a discount. The day one eye check is gonna cost you 150 zlotys, which is £30. So I would say the whole procedure takes up to £2,000, something like that. When I think it's for both eyes. When I think in UK you would have to pay £4,000. So the day one, you're not allowed to wear makeup. Always, another thing that I would recommend you to do is drink as much water as you can. Obviously, basically keep yourself hydrated, because the problem is the procedure is very dehydrating when it comes to your eyes. It's very drying for your eyes. So that's the day one of an eye check. The next day, after you had a good sleep night, okay, have a very nutritious breakfast. So you're allowed to eat, because I know some procedures you're not allowed to eat, but for your eyes you are very much welcome to eat. And another thing is avoid drinking coffee or tea because they're dehydrating. So obviously, again, don't drink alcohol, and drink water. Wear comfortable clothes. So what happens? I went to the clinic. I would say be there 15 minutes before. Obviously, don't wear makeup on the day. Have your hair tied, but if I was you, I would tie it as high as you can, and the reason for it is because you're gonna lay down during the procedure. And on the day you arrive, you have a quick eye check, and then the procedure starts, and they give you not a coat, but they give you like a robe, like a hospital robe, and they give you a hairnet. It's not a hairnet, but you cover your hair. I think they actually asked me to take off the hair tied from my hair. So sorry, you won't have to tie your hair because you've got that hairnet, so you can put your hair in there. They obviously ask you to remove your hair from your face. So if you've got fringe like I do, they will ask you to put it in the hairnet. And they take you to the room where they basically ask you to sign the confirmation that yes, you agreed to do the eye surgery. And they also ask you to wear covers for your shoes. So you stay in your clothes, but you basically cover them. So I guess there won't be any contamination with your eyes, if that's the right word. I don't know. Then they give you the eye drops that are supposed to work as anesthetics. So you do have that weird feeling in your eyes that you don't feel them. And then you wait for like 15 minutes. I think they repeat the eye drops for 3 times. And then the procedure starts. And they take you to the surgery room. And I have to say, I wasn't scared until this point at all. But when I saw the bed, I thought I was gonna have a panic attack. And the reason for it, maybe it doesn't look scary, but you've got a bed and you've got something like, it looks like a bridge above your eyes, that it's above your head, that is divided into 2 pieces. And the reason for it is because one piece is for one eye, one piece is for another. And so I went there and they had that piece, and I just panicked, and they asked me to lay down. And the doctor, the doctor that I had did my surgery was very good. He was explaining what he had to explain, so he didn't get into many details, thank fuck, because I would literally have a heart attack. But he asked you not to move. They do have suspenders, and let me tell you this. They do have suspenders, and they also give you the ball before, like the squeeze ball, the stress ball before. But let me tell you this. It's not because it's painful, it's because it's so fucking scary and uncomfortable. It's unbelievable. So when I lay down in my bed, they give you some sort of, I don't know how you say it in English, but I don't know if you watched A Clockwise Orange. So they basically give you something that's gonna spread your eye and then gonna stop your eyelid from moving, so you're not gonna be blinking while the procedure. And I thought that was gonna be the worst part of the surgery, because I knew that was gonna happen. And it wasn't uncomfortable at all. It was actually it. So the doctor says, oh, it might feel a bit weird because you're not blinking, because it stops you from blinking. And I actually felt like I was still blinking, because that twitch in your eyes is still happening, but your eyelids don't go down physically. So I had those stretchers, I don't know how it's called, blink stoppers. So after they give you those stretchers for your eyelids, the procedure starts. And your procedure might differ a little bit, because I had astigmatism and I was short-sighted. So the first, so I had two types of lasers, I guess. So the first one is basically the experience that I had is you need to look in, they sort of, it feels like a lens a little bit. So they basically they press the plastic lens. The doctor tells you that you might feel a bit of a pressing feeling, and it might feel weird because we normally don't feel that pressing feeling in our eyes, like something was pressing or pushing in your eye. During the procedure, the surgery in itself, the doctor was watering my eyes. Like I don't know what the substance was, if it was just water or it was something else, like sort of medication or something, but he put something like a see-through liquid, like water looking liquid in my eyes, and it felt really nice because it was very cool in feeling. Even though I had anesthetics, I could feel that it's cool, like it's cool, but it wasn't unpleasantly cool. When that pressing thing happens, you feel like you don't see anything, and that's when procedure starts. And the second one is you look into the light. And I remember when they did my other eye, this is kind of cringy. I felt like I was, the smell that was in the room started smelling like a burnt meat. I know, it's disgusting, but the whole procedure is not painful or anything or uncomfortable. It's just like, it is uncomfortable because someone is doing something to your eye and you can't do anything, and they hold you, but really it's not painful at all. It's just so stressful and uncomfortable. So the laser thing in itself, I think, takes a minute or two. It's probably going to take a minute if you've got just short-sightedness or just astigmatism, but because I think I had two, the reason why that's why it lasted 2 minutes. And the same thing happens with the other eye. So really it's not bad at all, it's not painful. And I wish, and you know, the thing that lady told me, because I forgot to say that before the procedure, there's that lady, there's like sort of patient assistant, and the lady is telling you everything about the procedure, like, oh, so now we're gonna do this and then you're gonna do that, and after the procedure. So she's basically following you everywhere until the surgery room, and she's just basically, oh, so this is the code, I'm your friend. And she was very, very friendly. I have to say, this is a great idea because it's very calming to have someone like this, so you're not in a room, anesthetics room, by yourself waiting to be slaughtered. There is somebody with you actually explaining to you. And I remember the thing that she told me is, if you it is because I told her like I'm getting nervous now, and she said, you know what, if you trust me, majority of the patients that I had told me that if they knew that it wasn't as scary as they thought it was gonna be, they would do it again. So yes, I agree with that 100%. It does look scary and you feel scared before, but it's not scary at all. It's not like, it is scary, but it's not reasonable fear, if that makes sense. Like there's really nothing to worry about or to be scared of. And I feel like the whole procedure in itself is very smooth and very easy. And after the surgery, you being taken to the room, you're being given another anesthetic, so you keep that sort of anesthetic, like the painkiller in your eye for a bit. Even though after the surgery you feel like your eyes are cloudy, I could tell straight away that it's like my eyesight is more sharp, like the things that I see are clearer, because it's like cloudy. It's cloudy as after like you would cry, but you know that after you cry, even though it's cloudy, you can see things clearly. So I could see things clear, and I'm like, oh my god, I'm so fucking happy I can actually see without wearing contact lenses or without wearing glasses. It's just my eyes being capable of seeing, and that feeling is amazing. Like it awards all the stress that you felt, because it's just stress. There's no pain during the procedure in itself. After the procedure, being taken to the room, you're being given more eye drops that I feel like they're supposed to keep that pain away for a little bit longer. And then I went to my hotel room, and the huge mistake that I've done is that because I was vlogging in the morning on the day, my phone was dead. So because my phone was dead, I couldn't call the taxi. And I'm sure if you ask the receptionist, because they have a reception, if you ask the receptionist to book your taxi, she would do that with no problem. But obviously I was fucking too stupid and I just left. And when I went outside, my eyes started getting more and more sore. So, and I had to take a tram because there are trams in there. There are trams in Krakow, and the best way of communication is tram. And I was just sitting like that in that tram all the time because I just felt like I can't stand the light. Because the problem is there's no sunlight in the clinic. All the windows are covered, and in the place where you're being sat during and after the procedure are being darkened, so there's no natural sunlight coming in, so you're not aware of how your light, so you're not aware of how light sensitive you are. Thank you for watching this part. Please hit the subscribe button, bell button next to it if you want to keep up with what's going on my channel. Thank you very much for watching and have a lovely day. Bye.